Everyone, I'm Sebastian at Performance Place Sports Care. I'm going to show you my 4 favorite stretches for lower back pain and correlated nerve root impingement or pain shooting down to the leg. Now, this is a representation of my pinched nerve here. It comes off my back here, kind of goes into the butt cheek, down the back of the thigh. It can go all the way down to the back of the calf, even right down into there, just letting gravity take the whole thing, right? Bottom of the foot. Now, some of you will call this problem right here into only the glute area sciatica. It's not technically sciatica, but consider this different versions of sciatica, different severities. The further it is down your leg, the more advanced it is. Now we're going to go through these these stretches here. At any point in time, if you feel like it travels further down your leg, this is a bad idea for you. Ideally, we want things to move up like a thermometer, and a lot of these exercises do it for different clients that we have at Performance Place Sports Care, but there's not actually one specific stretch that works best for everybody. So it's all individualistic. The first thing we're going to do is we're going to do a hip flexor stretch, or sorry, a hip flexion stretch. And so it's going to be right into here. You're going to take your non-symptomatic side first just to test the water. And with everybody, I really like to make sure that they check the uninvolved side first. If I bring my knee towards my chest here, it should just kind of feel like nothing, not much at all. Maybe a little bit of pinch right here, but not too bad. But I don't have pain shooting down the leg. My back pain's not increasing. Like, this is normal, all right? And so what you're looking for is all these to feel generally symmetrical. And if I try this side and it shoots pain down into my foot, then I know this is not right for me. So everybody start on the uninvolved side first, and you're going to take this knee and start to bring it towards your armpit, all right? Now we can start to add a little bit of breathing involved too. The breathing is simple. In the nose, out the mouth. Okay? When you breathe out the mouth, it's going to be like you're breathing out of a little straw that you got from a McDonald's. In the nose. Out the mouth. Good. Now what you can do as well is you can do a little bit of a crunch here, just slightly, just almost like you're looking at your knee. And what this does is, if you're dealing with something like the pinch in the front, for a lot of people this reduces the pinch in the front, all right? And then you come on down, and then you come back up, do the breathing in the nose, out the mouth, and so on. I like to have people do kind of reps in association with their breathing. 5 reps per side or 5 breaths per side, and then you change sides and see what the symptomatic side is doing. The next one we can do, I'll show you on this side for me, gets the microphone out of the way, is a hip stretch, not only for the back side of the hip, but also the front side too. And so this one, same thing, you start with the non-symptomatic side first, and you bring this knee across your body to the opposite shoulder with light pressure, all right? I don't feel any problems in this. I feel a little stretch into this area, which is completely normal, but I don't feel the front of the hip either. If you feel the front of the hip, you may have something like hip impingement that may be, it's gonna make this one challenging for you. In that case, there is a way to combat it, and it's the breathing. You wanna breathe into your finger here. So in the nose, directed to the finger, out the mouth. For a lot of people, they feel that when actually they breathe into the finger here, number one, they think it's very challenging to do, and it's woo, and it's complicated. But after a couple reps and they start to get it, they start to feel this reduce, okay? And that's great. That means that a core support type of approach would really help you with that part of your problem. Next part is we're gonna push away, and this is gonna get a little stretch in the front part here. Breathe in. Out the nose, or out the mouth. Switching back, in the nose, out the mouth, and so on. Maybe 5 times per area, and then we're gonna go here again, in the nose, and out. Now, if you're having symptoms again with this, you may consider that, number one, this may be the wrong stretch for you, or there might be the possibility that you're actually arching your back up off the floor. Okay? We find that a lot of people who are over the age of 40 or 50 who have had long-standing problems with their leg or their back, they tend to do a lot of this stuff, all right? Younger people can have this too, but they don't have a long history with their back, so a lot of times they'll stay relatively flat and it's not a big of a problem. Okay, but if you go like this and your pain goes down your leg or to your hip, then this extension is part of what's maybe driving your symptom. In that case, the next exercise may not work very well for you. The next one is going to be, it's reading book at the beach position. This works really well for people who are, 15, 20, 30 years old or so. But it doesn't mean it can't work for people at different ages as well. It's just more commonly it works for the younger populations. But this is the position where you're reading a book at the beach and you just have a really nice novel and you're hanging out here and that's it. You're breathing in the nice air, blowing the pages to the next page and so on. You can be in this position for about 30 seconds. For most people, it feels pretty good. Then you can progress this thing a little bit. By the way, if you do have questions already about well, how come arching my back and rounding my back maybe are problems and why does this happen in the first place, we do have a webinar in the corner. So take advantage of that at any point. It's completely free and it helps you figure out more about what you should do for your back and your pinched nerve too. The next thing we're going to do is we're actually going to look over, imagine there's a sand dune now, it's over there. We're going to look over the sand dune and we're going to use completely our arms to do the work. It's like from here down you're completely paralyzed. And so I'm just going to look over the sand dune, check out the waves. They're not good enough for me. All right, I'm going to read my book again. Spend about 30 seconds reading your book. Then you're going to check the next set of waves and go again. Now, some of you might say, well, I can't bend my back that far. That's okay, all right? If it shoots pain down your leg, that's not okay. And so whenever we're trying to solve people's pinched nerve problems from their back, we need to make sure that, number one, that anything that you do does not start to increase the problem. That whole no pain, no gain type of stretch it out, I'll stretch through the pain, that's all, no, you shouldn't be doing that. It may be okay to feel some stiffness here, but to be fair, just for some of you who have been using something like this, look over the sand dune type of approach for a long time, this has a side effect all on its own. All these exercises stretches have side effects of their own. At some point in the long term, you need to build support around your spine and make it so your hips work well, or else this is going to be a reoccurring thing. And I don't mean that in a bad way. I'm just being realistic with you. I'd rather you know the information that you have to do a supportive approach. We do have videos on our YouTube channel which help people out with that just a little bit too. All right. We also have custom programs too, so reach out to us. The next thing you can do is stretch number 4 is going to be a really light frog pose. All right. Some people might be looking at this, well, that's kind of like a child's pose. Well, it's here, and we're going to be just sitting back as close as you can, hips to your heels. If you can't do this, you can put a pillow right here, which decreases how much hip range of motion or knee range of motion you have to use. But all we're going to do is we're going to be breathing into our thighs like a frog would be, okay? Now you may notice that when you take a deep breath in, you feel the middle of your back here, of the low back, it starts to stretch. That's okay. What's not okay is it going down your leg, okay? Breathing in and out. Now for a lot of people, we notice that actually the stretching feeling actually dissipates after about 30 seconds to a minute of doing this. After they start walking around for a while, they may notice that some of their the stiffness returns, their pain goes down their leg and so on. And so I want you to take advantage of the webinar that we have available to you because there's different types of back pain and sciatica. That's the most confusing thing for people, it seems like, is they're like, well, what one stretch helps? Sciatica is this diagnosis that we should know how to solve it. Sciatica is a symptom. It's not a diagnosis, it's a symptom. Sciatica means leg pain. There's many different things that can create leg pain, like foraminal stenosis, disc herniation, disc bulges, disc extrusions, space-occupying lesions. There's many different things that can create it. And so for that reason, your tolerances of movement will be different. Some of you rounding your back will not feel good. It'll travel down your leg. For other you, arching your back will not feel good. It'll travel down your leg. So at some point, you do need to figure out what's going on. We can help you with that. Or our webinar covers tolerances of people's spines and really how do we resolve them here at Performance Place. And so if you guys are looking for help, we'd love to help you with this. We see a lot of people with sciatica, low back pain, hip, groin, sports hernias, hip impingement, labral tears, you name it. This quarter, we love it. It's great. Front and back of the body, so we'll help you out with it. Please contact us in the link description below the video. We'll do our very best to at least redirect you to a place close by to you if we know of one, or if we can help you directly, we will help you too. We'll see you guys next time. Subscribe to the channel. We have more videos just like this coming on hip, pinched nerve, low back right here on YouTube.